During feast meals, approximately 75% of people report some type of physical discomfort, and only 10% of them are caused by true disease or potential dangerous pathology. 90% of them are functional physiological reaction to overeating alcohol, salt, fat, and sugar. The third problem is bloating after large meal. Why it happens? Because primary mechanism is mechanical stretch, stomach distension. Large food volume stretches the stomach wall, activating mechanoreceptors, which signal fullness, pressure, and tightness. Secondary mechanism is fat intake. Fat stimulates cholecystokinin. It's a digestive hormone which slows gastric emptying. Food remains longer in the stomach, increases gas formation by bacteria because foods are fermented by bacteria and they creating gas. At the same time, undigested foods, especially carbohydrates, sweets, bread, desserts, and alcohol, reach to the colon, where gut bacteria ferment them, producing carbon dioxide, hydrogen, and methane. Gas accumulates and causes bloating. And now let's say what you can do. First, you can slow walking for 15 minutes after meal and be upright position. It's important because gravity pulls the food down, and avoid lying down for 2 to 3 hours to avoid heartburn. From medication, you can use Simeticone. It breaks gas bubbles and relieves functional bloating in 70% of cases. Activated charcoals also absorbs gas, and peppermint oil capsules. They have an antispasmodic effect and they reduce bloating around 40%. Red flags are if this bloating is progressive, if there is severe pain and fever and bloating persisting for several days. Second problem is nausea and vomiting after overeating. It happens because extreme stomach distension activates protective brainstem reflex, trigger nausea and vomiting. This is defensive mechanism, not poisoning or infection in most cases. Medications at this case commonly used are domperidone, which improves gastric emptying, and metoclopramide, which has anti-nausea and pro-motility effect. Ondansetron blocks serotonin-mediated nausea. It has strong effect, but rarely used. And ginger extract, it's mild and safe and reduces nausea in 30% of cases. The third problem is heartburn after heavy meals. It happens because overfilled stomach increases intragastric pressure and causes transient relaxation of lower esophageal sphincter and acid reflux into esophagus, producing burning sensation and burning pain, especially when you eat fatty foods, chocolate, alcohol, and desserts directly relax the sphincter, increases reflux risk. In this case, most effective behavior is don't lie down for at least 2 hours after eating. This alone can reduce post-meal reflux around 60% of cases. On the other hand, you can intake calcium carbonate antacids, which has rapid symptom relief, or aluminum or magnesium hydroxide combinations, and famotidine, histamine 2 receptor blocker, omeprazole or lansoprazole for short-term acid suppression therapy, and alginate formulation for mechanical barrier against reflux. The fourth problem is gastric irritation. It happens because of large meals stimulates excess acid production. Alcohol, spicy foods, salts, and non-steroidal anti-inflammatory drugs weaken the gastric mucus barrier, allowing inflammation. This occurs more in people with pre-existing gastric vulnerability. And typical duration is 24 to 48 hours, and people describe it as a gnawing pain and aching, stomach aching. And when this stomach pain lasts around 24 hours, sometimes 2 days, it is considered functional irritation, and if it lasts more than several days, usually it's gastritis. Treatment at this case is omeprazole, lansoprazole. They are proton pump inhibitors. Usually they are taken once daily. And famotidine is important for acid suppression, sometimes in addition to omeprazole or lansoprazole. Sucralfate is used for mucosal protection, and bismuth subsalicylate has anti-inflammatory and protective effect, but usually they are not required because it's self-limiting irritation. And fifth important problem is gallbladder pain without gallstones. Because fat intake stimulates cholecystokinin, which is hormone, and it causes gallbladder contraction. And if bile is thick or flow is temporarily sluggish, this contraction can provoke biliary spasm even without gallstones, and pain occurs in the upper right part of the abdomen, somewhere here. And this pain lasts around 6 hours, rarely up to 24 hours. And in this case, drotaverine can be effective because it's smooth muscle relaxant and causes relaxation, and it's antispasmodic. Also, hyoscine butyl bromide, it is antispasmodic. Also, papaverine, also biliary effective for biliary spasm relief, and paracetamol can be used as a pain reliever. Also, deoxycholic acid also can be used if symptoms are recurrent, and if person has severe pain more than 24 hours, it is red flag. Also fever or jaundice or severe upper quadrant tenderness and pain when pain is very severe. And sixth problem is blood pressure rise after feast meal. It happens usually due to sodium overload, because sodium rises blood pressure around 20 millimeters of mercury in salt-sensitive individuals. And sometimes it happens because of alcohol. At first, alcohol causes lowering blood pressure, but after some period, it causes increased blood pressure because of delayed vasoconstriction after 12 or 24 hours and lasts around 3 days. So alcohol can cause increased blood pressure and sleep problems also. In this case, most effective action is to reduce salt intake around 2 days, avoid alcohol completely, and gentle walking, and continue prescribed blood pressure medications. Medications, if already prescribed, like amlodipine, enalapril, losartan, hydrochlorothiazide, or bisoprolol, are most common.